More than 2,000 locally acquired cases across Australia today, of course, the vast majority in just 2 states, 2 of the 4 outbreaks that we are tracking across the country. And this is a mountain of cases by Australian standards, far bigger than all of the cases that we experienced through last year. In Victoria, the state that's recording the most cases on a daily basis right now, another 1,377 added to the tally. So after this big step jump yet last week with cases linked back to social events over the AFL Grand Final weekend, what we've now seen is, again, just that growth rate continuing at its pace that it had been before that step change. Basically, the curve is still growing, and with it, so are people getting seriously ill. The number of people in hospital growing to just under 500 today, and that's growing relatively quickly, and people still dying. Another 4 deaths recorded today in the state, and unfortunately that will not be the end of it. We know where this kind of trend line ends up. We've seen it now several times. The one glimmer of hope, well, it's in the individual LGAs most affected. The city of Hume in Melbourne's north, 278 cases a day still, but look at this, we've seen a real flattening in the speed of growth there. This may well be the effect that the vaccines are now having on the curve and the case numbers and transmission in that part of the city, especially now that that area has been made a priority for vaccinations. The Chief Health Officer, Brett Sutton, he's optimistic about what this means. I think we need a few more days of data to really be sure, but certainly a positive sign, and we hope that we'll begin to see some real improvement in some of these areas in particular that have been really badly affected. In New South Wales, we have another day in the 600s today, 623 new locally acquired cases. The 7-day average keeps improving, down now to 805. And when you look at the kind of regional picture, it's really, in Sydney, we're seeing dramatic improvement across the entire Greater Sydney area. It's regional New South Wales, we're still seeing things worsening, and it's really just 2 particular areas that have the bulk of these cases. One, the Illawarra Shoalhaven Local Health District, so that's a really steep trajectory, flat for a couple of days, but still quite a lot of cases there. And Hunter, New England has just taken off in the last few days as well, that quite big local health district stretching from the Upper Hunter region kind of further to the north of the state. So for this reason, still worries in regional New South Wales, and we may well see the improvement across the statewide curve slow down as these cases continue to grow. Hopefully we see some improvement there in the future, because we do want these cases to come down everywhere. In the ACT today, we have a smaller number than the last few days, 28 cases. Again, most of them have some exposure in the community. The trend line continues to be kind of growing in this outbreak, especially after those days of 52 cases a few days ago. The good thing in the ACT is phenomenally high vaccination levels. In virtually every age group over 40, you're looking at first dose levels of at least 90, in most cases more than 95% of people. So that is preventing a lot of serious illness. Having said that, 2 more deaths, unfortunately, today. Both women in their 80s. One of them was a resident of an aged care home who was receiving end-of-life care prior to being infected. And in Queensland, 1 more case as well, and this one, unfortunately, is unlinked to any previous clusters, and she may have, well, it sounds like she was in the community for 10 full days while infectious. So a bit of work there to be done to map out the risks of that cluster. But the good thing is she was double vaxxed, and to this point, all of her household contacts have so far tested negative.